Okay, so I've been working with this patient for the morning. I just assisted this patient to void, and he only voided 50 milliliters. He said that he still had a sensation, an urge to void. So at this point in time, I did a bladder scan, and I found approximately 510 milliliters in there of the post-void residual. I do this twice just to make sure that I had that right. And my colleague, Karen Foyer, called the doctor and got a phone order for a Foley indwelling catheter. With a post-void bladder scan of greater than 400. We've just said it's 510, so that's great. We're going to go ahead and put a catheter in. When I was doing the bladder scan with the patient, I did patient education about how after a void, we want to see less than 100 milliliters in the bladder. His was 510. This is a problem. I also informed the patient that a normal bladder capacity is between 300 and 400 milliliters for an adult. So the patient understood that we were maybe going to put a catheter in, and he's had that education piece already. Now I'm going to go back into the room just to let him know before I get supplies. Okay, as I go into the patient's room, I'm going to do a safety check. So that is making sure that the bed is at the proper height, the bed brakes are on, the side rails are up, the call bell is within reach, and the oxygen and suction work. For the purposes of this video, the bed is going to stay at this height and 2 of the rails are down for my working. Hello, Mr. Smith. So my colleague just got off the phone with the doctor, and it looks like the doctor did want us to go ahead with putting the catheter in. So do you have any issues with that or any remaining questions?
Nope.
Okay, before I go and get the supplies, could you just let me know, do you have any allergies that you're aware of?
Nope.
Okay, no allergies to latex?
Nope.
Okay, and do you have a history, I didn't see anything, but of an enlarged prostate or any issues with that area of your body?
Nope.
Okay, great. Have you ever had a catheter in before?
Yeah, actually, I had one last time I had surgery for my hip.
Okay, great. And how did that procedure go for you?
It was totally fine, no pain or anything.
Okay, good. So I'm hoping that'll be the case again today. And are you experiencing any pain or discomfort at the moment in general?
Nope.
Okay, great. Before I go get the supplies, could you just confirm with me your full name and your date of birth?
Yeah, it's Taylor Smith, March 7th, 1964.
So I've checked the order sheet, and I'm also going to check his wristband. That's good. Okay, Mr. Smith, I'm going to go and get the equipment, and I'll be right back.
Okay.
As I leave the room, I do another safety check. So now I'm coming outside of the room to get the supplies. I'm also just going to show you for the video the order. So I do indeed have permission with a post-void residual of more than 400 to put an indwelling catheter in. Okay, so I'm just going to put that back in his folder. I'm going to perform hand hygiene upon leaving the patient's room, and I'm going to grab my supplies. So what I need is a urinary drainage bag. I need a Foley catheter tray kit. I'm going to get my sterile gloves size 6. I'm going to get a sticker for his leg to secure the catheter tubing, skin prep for that, and I'm also going to get a catheter. I'm going to check all of this packaging to make sure it's not expired. And just before I go in, I'm just going to confirm that I have the right size catheter. So this is a size 12 catheter, 12 French. And yeah, that's the smallest size catheter, and that's great. And I'll see, okay, we can inflate the balloon with 5 to 10 milliliters of sterile water. So that's all good to know. Then I'm going to come back into the room, put this down. Hello, Mr. Smith. How are you doing?
Good.
Good. So I'm just going to get everything set up for the procedure.
Okay.
You can just relax for the time being. I'll make sure that I'll wipe down this counter with Virox. I hand sanitize. Before doing the bladder scan, I had put down a dry pad just because I'm anticipating some issues with the bladder. So that's already there. Okay. Now I'm going to first take out the drainage bag. Okay, and put that in the garbage down here. Garbage down here. So once again, I've made sure that nothing has expired, and I'm going to leave this tip on so it remains sterile, and just make sure that this is all connected in the right place so we don't have any accidents. Mr. Smith, do you mind if I use your bed to keep a couple things on while we do this?
Absolutely.
Okay, that's great. So I'm just going to put that down at the foot of the bed. Also, in real life, we would have this at the head of the bed, but for the purposes of filming, I'm going to have it down here. Okay, so then I'm going to set up this sterile field. Throw that in the garbage. Okay, so that's great. I'm actually going to put it right there for now. And this little drape I'm not going to use because I'm actually going to move this whole contraption to the middle of his legs, so I can discard of this. I'll just put that in the garbage down there. There's the garbage bag, so I'm going to get that out. Set that up. I'm just going to put this garbage bag for my supplies on your bed.
Okay.
This is a nice big garbage bag, so that's awesome. Okay. And now I'm going to add my catheter to the sterile field. So it's also wrapped in plastic. So I'm just going to go ahead and kind of take that out and then use my sterile forceps to just grab this and place it into this kit. And I don't need this anymore, so I can put that off to the side. I'm going to throw all of these things into the garbage in the room, and now I'm going to put on my sterile gloves. So before I do that, I just want to position the patient. So Mr. Smith, I'm just going to get you in a good position. Do you have the ability to bend your knees and kind of spread your legs?
Yeah.
Okay, that sounds good. I'm just going to lift up your gown. Is that all right?
Okay.
Okay, so I'm going to do that, and Mr. Smith, we would assume, could do this on his own, but for the purposes of the video, I'm just going to kind of open his legs out a little bit. And now I'm going to put on my sterile gloves. So hopefully this procedure will help relieve some of that, the urge that you have to void.
Perfect.
Yeah.
Yeah, I really just feel quite full.
Yeah, it's not a fun feeling. So I am left-handed, so I'm going to put my left hand in first. Actually, before I put these on, I'm going to hand sanitize.
Oops.
Okay. Nothing like a brand new pair of sterile gloves. Okay, so these are on. And I'm just going under this cuff to just pull that back too. Okay, so now I'm just going to let that slide off into the garbage. And I've already done PPID, but I'm just going to once more. Mr. Smith, can you please give me your full name and date of birth?
Yeah, it's Taylor Smith, March 7th, 1964.
Okay, and I have that in my mind from just doing that, so that's great. And now I'm going to move this whole setup just closer to the patient. So Mr. Smith, I'm just going to bring this catheter kit in between your legs now.
Okay.
Okay, so I'll put that down there for now. All of this is sterile, so that's not a problem. Okay, and now I'm going to get this ready. So I'm going to take out this cup with my gauze and just put it off to the side. And I'm gonna open up this. So this should be, it's sodium chloride. It's a cleaning solution. So I'm gonna just put that into the gauze, making sure to not spray any of that water anywhere else. Great, and I'm done with that, so I'm gonna throw it out. And, okay. I'm also going to just take, I know that there's, so this is sterile water. It says to inflate the catheter, and there's 10 milliliters in here. I only need one of them, but I guess just in case something goes wrong, I'll keep them both on my sterile field for now. And I'm also going to put some lubricant just on the base of this tray for the catheter. So I'll open that, and I'm not going to do it for the purposes of this video with this mannequin, but I'd squeeze it out onto the side of the tray there. And okay, now we're ready to clean the urinary meatus. I'd also just like to verbalize at this time, for the sake of the video and demonstration of skills, I'm not providing peri-care, but this is at this point before the procedure is when I would do a really thorough peri-care. So I would have also brought those supplies in, and I'd be completing that right now. So I've just kind of put these off to the side so that I've got a good hold of them, and I'm ready to take hold of the penis. So if it was a circumcised penis, I would draw back the foreskin a little bit, and I'm just going to grab the shaft, and I'm going to gently bring it to a 90-degree angle and kind of pull up just to straighten out the meatus. Okay, and now I'm going to grab my forceps, and I'm going to clean the urinary meatus. And how I go about doing that is I go from the tip and then out in a circular motion. So I'm going to start up here and then just do once and get rid of that in the garbage. Okay, do that again. And one final time. How are you doing, Mr. Smith?
Good, yeah.
Okay, any discomfort as I clean?
Nope.
Okay, that's great. Okay, so I've done that 3 times. I can get rid of these forceps now. I don't need them anymore. And now I'm going to go ahead and grab my catheter. I'm going to grab it about 3 to 4 inches from the tip, and I'm going to lubricate it. I'm going to lubricate it 12.5 to 17.5 centimeters. And once that is all good, I'm going to insert it. So I'm going to move this kit a little bit closer so that if any urine comes out, I can catch it for measurement. Okay, so Mr. Smith, I'm going to be inserting the catheter in now. So what I'm going to get you to do is just focus on your breathing and focus on relaxing your body, okay? That's going to help it go in as smoothly as possible. Sound good?
Yeah.
Okay, great. So this time he breathes, and I would try to advance it on an exhale. So I'm just going to go ahead and feed it in. And I'm going to advance the catheter until as far in until I get a urine stream coming back. Okay, so we'll say at this time I see some urine coming. I'm going to just advance it in slightly further just to before the bifurcation. So the catheter appears to be in. We have urine flowing, that's great. So now I'm going to advance my hold with the clean hand to the actual catheter, and I'm going to inflate the balloon. So how does that feel, Mr. Smith?
It's good, yeah.
Okay, good. So I've got a hold on this, and now I'm going to take one of my sterile waters, confirming, yep, once again it's sterile water, and I'm just going to pop off the top with this hand. Okay, now I'm going to connect this. Okay, and once again, I know that I can inflate 5 to 10 milliliters in here into the balloon. So I'm just gonna see how this goes, and it looks like all of it is going in, no problem. So that's great, and with my hand on the plunger, I'm just gonna remove that. Okay, so that's great. Now at this point, what I'm going to do, just to make sure that the balloon is actually situated in the bladder, is I'm going to gently pull back until I feel a little bit of resistance. So there I do. That's kind of it coming into contact where the bladder and the meatus, or the urethra kind of connect. And I'm just going to advance it a little bit more so I know it's in the bladder. Now I can let go of the penis, and I'm just going to connect the drainage bag to the catheter tubing. So just to maintain the sterility on this, I'm going to make sure that I don't touch that, and just connect it there like so. Make sure that it's on as far as it can go so it doesn't come off. Okay, how are you feeling, Mr. Smith?
Good.
Great. Well, it's in, and it looks like we had minimal problems, so that's wonderful. It was a smooth procedure. I'm going to take this with urine and plan to measure it after. And I'm also just going to, we don't need to be sterile anymore, worry about sterility anymore. So I'm just going to move this to the side. How are you feeling now that some of that urine's come out?
Really good, thanks.
Oh, great. So at this point, what I'm going to do is I'm going to connect the tubing to the leg. So I will, actually, I'm going to take off these gloves. And I'll do a little hand sanitize. And I'm going to put on a pair of small gloves, and I will skin prep the area. Mr. Smith, do you have a preference about which leg I secure the tubing to?
Nope.
Okay. Good to know. So I'm just going to do it to the one closer to me. I'm going to remove the skin prep and put some on his leg. Let that dry, and then I'm going to put this down. Now, the physician did not specify exactly where he wanted this on the leg, so I'm just going to kind of go with my discretion, and I'm going to secure it so that there's a little bit of leeway with the tubing, so that if he moves, it's not going to be pulled or dislodged within the urethra. So this, that looks like it'll be about good. Okay, and I'll just put this down for a minute and just pull this off. Okay, so before I secure this, Mr. Smith, does that feel like it's comfortable?
Yep.
Okay, great. So yeah, it looks like there's enough leeway there. I'm going to go ahead and secure this. And now I'm going to put this bag on the bed, and I'm going to make sure to not put it on the bed rails, but just on the side of the bed, so that with any movement it doesn't get dislodged. And I'm also going to just make sure that I see a solid stream coming down, and just ensure that the bag is in fact below the level of the bladder, so that it's draining with gravity. So that's great. At this time, I would clean up all of my supplies. So Mr. Smith, I'm going to just tidy up and put this stuff away, and I'll be back shortly to just see how it's draining. Do you need anything or have any questions?
Nope.
Okay, sounds good. So I'd leave the patient's room, I'd make sure that the safety checks have been done, that he has the call bell, and then I would leave. I would document how this procedure went, how the patient tolerated it, and all of the equipment used, and I would measure the urine, document that, and go back and check on him shortly. I would also just quickly like to specify that this is a 2-person procedure, but for the purposes of this video, I've just done it with myself alone. And I think that's everything.